Within your body, there are 7 urgent warning signs that indicate you should get to the hospital as soon as possible. There are indications that your body gives out when something is terribly wrong. In some cases, being able to identify them can be the deciding factor between life and death. Today, we are going to discuss 7 bodily symptoms that cannot be disregarded under any circumstances. These symptoms should be taken seriously at all times. The following are the warning signs that, according to medical professionals, call for immediate hospitalization. There is no waiting, and there is no hesitating. There is no intention of frightening you. You are the focus of its protection. There are a lot of elderly people who put off getting aid for too long because they either believe it is absolutely nothing or they simply don't want to disturb anyone. However, in many instances, an early response can prevent a relatively modest situation from developing into a severe crisis. Furthermore, the most important thing is that being aware of what to look for allows you to regain control over your health. In this video, you will educate yourself on the 7 warning indicators that are present in your body that medical professionals advise you to never ignore. There is no ambiguity in these symptoms. Particularly, they are very real, extremely detailed, and in many instances, they are time-sensitive. We ask that you remain with us until the very end because one of these warning signs could very well save your life or the life of someone you care about. The time has come to get started. Either slurred speech or facial drooping. Sign 1, or both. Stroke is a medical emergency that cannot be delayed, and there is a precise set of symptoms that doctors and nurses are trained to recognize immediately. These signs indicate that medical emergency. It is possible that you will find that your words come out if you suddenly find it tough to talk. If you notice that one side of your face isn't moving as much as the other. Your vision may be slurred or garbled. It is imperative that you visit the hospital without delay. If you are unable to lift one arm or if it moves downward when you attempt to lift it. The same thing applies. These are hardly grounds for taking a break. Your brain may be in serious peril if you experience any of these symptoms. According to a statement made by a doctor, for every minute that a stroke is left untreated, over 2 million brain cells are lost. Time is more valuable than money. Memory, speech, action, and even life itself are all included. That is a difficult fact, and it is one that the majority of people do not really comprehend. Even in the absence of any warning, strokes can occur in elderly people. During the course of a typical day, you might be reading the newspaper, watching television, or eating lunch when all of a sudden, your words don't come out the way you intended them to or your grin takes on an uneven appearance. Although these minor alterations might feel weird, they are not frightening. However, this is precisely what makes them a threat, for the reason that the sooner you seek treatment for a stroke, the better your chances are of making a full recovery from the condition. Robert, a Vietnam veteran who is 68 years old, is an example. When he was drinking coffee one morning, he accidentally dropped the cup from his right hand, and he was perplexed as to why he had done so. His statements did not come across as being appropriate as he yelled out to his wife. After taking a single glance at his face, she noticed that his smile was crooked, and she immediately dialed 911. Within an hour, Robert was under the care of medical professionals, and he made a remarkable recovery. In the future, he revealed that if she hadn't moved quickly, I might have been in a wheelchair or much worse. When it comes to teaching patients how to spot a stroke, the medical world employs the abbreviation FAST, which stands for face, arms, speech, and time. However, the portion that the majority of people overlook is the final letter T, which stands for time. This indicates that each and every minute is important. In the event that there is slurred speech, facial asymmetry, or abrupt weakness, you should not take a nap. You shouldn't wait for an appointment with the doctor. Call the emergency services and ask for assistance, as a result of the fact that prompt action could save your capacity to walk, talk, remember, and live independently while your brain is experiencing difficulties. A sudden tightening or soreness in the chest is the second sign. If you suddenly feel a pressure or ache in your chest that you cannot explain, this is one of the most urgent signs that your body may give you. There is a possibility that it will feel like a constriction, a squeezing, or even a burning feeling. It is also possible for it to extend to your jaw, shoulders, neck, and arms, even though there are some individuals who attempt to persuade themselves that it is nothing more than heartburn or nervousness. The truth is that this could be your heart pleading for assistance. And this is especially risky for people who are older because the symptoms of a heart attack might be subtle, sluggish, or altogether different from what you would anticipate an individual to experience. Once upon a time, a cardiologist reported the number of patients who arrived at the wrong time, considering that they believed it to be indigestion. It is really disconcerting. Get checked out if there is even a remote possibility that it is cardiac. When you take into consideration the fact that many heart attacks in elderly people do not arrive with the excruciating pain that we witness on television, you will understand that this statement is filled with a great deal of reality. It may be a dull ache, a fluttering feeling, or simply a feeling that something isn't quite right. Sometimes it's all of these things. If you do not engage in any physical activity, you may experience feelings of dizziness, shortness of breath, or abrupt exhaustion. These are not things that should be monitored, rather, they are things that should be acted upon. Consider the case of Helen, a retired educator who is 74 years old. While she was reading a novel one day, she couldn't help but notice a peculiar tightness in her chest. It was not unbearable, but it continued for a long time. She added that she speculated that it could have been gas, but something told her that she should call her daughter. When her kid arrived, she urged that they go to the hospital immediately. Helen was experiencing a small heart attack at the time. Thank goodness, she received treatment promptly and was able to make a full recovery. It's possible that I wouldn't be here if I had waited, she continued. Finally, I paid attention to what my body was telling me. In this case, that is the lesson. Your body does not always scream when it is in agony, rather, it frequently whispers this distress. In addition, when it comes to something as serious as heart problems, those murmurs can serve as a last indication. Waiting until you are unable to breathe or on the ground is not a good idea. If you are experiencing discomfort in your chest that is not familiar to you, if it is persistent, or if it is accompanied by other symptoms, you should go. Don't be curious, don't wait, and simply get going. I would appreciate it if you could use the second comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Now, let's proceed with our plans. Without exertion, the third sign is a feeling of shortness of breath. There is a distinction to be made between the sensation of trying to catch your breath after climbing stairs and the sensation of being unable to breathe while you are sitting motionless. The fact that you find yourself gasping for air in the middle of a calm time, whether you are reading on the couch, watching television, or even lying in bed, is not something that should be ignored. In the absence of any significant physical exertion, sudden shortness of breath can be a warning sign for dangerous illnesses such as heart failure, pneumonia, or even a pulmonary embolism, which is a blood clot in the lungs. Both of these conditions must be treated immediately. Each and every one of these calls for immediate medical intervention. It was once suggested by a respiratory specialist that if you find it difficult to breathe for no apparent reason, it is your body's way of signaling that it is raising an alarm. Not only is it due to aging or exhaustion, I am pleading for assistance. That phrase is especially relevant for people who are in their later years. Because of the natural process of aging, our lung capacity naturally decreases, and our heart has to work harder to pump oxygen-rich blood throughout the body. What differentiates a typical indication of aging from a medical emergency, however, is the suddenness with which it manifests itself and the severity with which it develops. A problem exists if you wake up feeling as though you are unable to catch your breath, or if you find that you are breathing heavily after doing anything as simple as walking across the room. Waiting could result in increased symptoms or damage that cannot be reversed. And it could be either your lungs, your heart, or both parts of your body. As an illustration, let's take the case of Walter, a retired electrician who is 70 years old. He had always been in good form. But one evening, as he was watching his favorite show, he had the sensation that he was unable to breathe enough while he was outside. There was no chest pain, no temperature, no activity, just this overwhelming sense of breathlessness. Because of the efforts of his daughter, he went to the hospital, where the medical staff discovered a little blood clot in his lung. Walter stated that it was possible that I would not have woken up if I had waited till morning. That is the lesson that should be learned. If you have shortness of breath, you should not monitor it later. It is something that should be addressed right away, particularly when it appears out of nowhere, worsens rapidly, or makes even the most basic of tasks feel like a strenuous workout. Rely on your own body. When anything is not quite right, it is able to detect it, even if you are not really certain what it is. You should go to the emergency department immediately if you find that breathing is becoming difficult for no apparent reason. Getting the truth is preferable. There was nothing worse than making the discovery too late. That was the whole thing. The patient is exhibiting signs of acute disorientation or unexpected bewilderment. When an elderly person suddenly becomes confused, forgets things that are familiar to them, or appears puzzled about where they are or what time it is, it is simple to attribute these behaviors to the natural process of aging. However, the kind of mental fog that arises suddenly, particularly if it is not consistent with the individual's personality, is one of the most dangerous warning flags that can be found. This may be an indication of a stroke, an infection of the brain, oxygen levels that are dangerously low, or even a violent reaction to drugs could be the cause. That being said, each and every one of those scenarios calls for emergency medical treatment. It was once mentioned by a hospitalist that in elderly folks, the brain is frequently the first organ to communicate that something is wrong. The flashing of the body's emergency light is the presence of sudden disorientation. This observation is particularly significant due to the fact that a significant number of elderly people and their families might not recognize perplexity as a critical situation. They might believe that it is simply a case of exhaustion or a bad day. On the other hand, when the change occurs suddenly, such as forgetting names, being disoriented in familiar areas, or speaking in a manner that is not logical, it is time to put it into serious consideration. These modifications in memory are not gradual in nature. Occasionally, there are sudden shifts that frequently indicate something far more profound. Consider the case of Linda, a woman who was 80 years old and lived on her own and was responsible for her own affairs. A neighbor of hers discovered her standing in the hallway of their building one morning. She was unaware of how she had arrived there or why she was there. She appeared to be surprised and kept asking the same question, despite the fact that she was completely dressed. Her family speculated that it could have been due to weariness or dehydration. However, upon her arrival at the hospital, it was determined that she had a urinary tract infection, which had contributed to the quick onset of delirium that she was experiencing. Through the administration of antibiotics and fluids, she was able to return to her normal self within a few days. According to her daughter, "I had no idea that something like that could cause confusion. I will never again try to ignore it. This is precisely the kind of result that we're hoping to achieve." Since the brain is sensitive, it frequently reacts to other issues, such as an infection, a lack of oxygen, or even changes in blood sugar, before it reacts to anything else. This is especially true in elderly people. In the event that you find yourself in a state of perplexity, it is not a good idea to wait for it to resolve itself. There is a possibility that it will, but if it does not or if it gets worse, the repercussions cannot be undone. I would appreciate it if you could use the fourth comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Now, let's proceed with our plans. Severe or abrupt stomach discomfort is the fifth or sixth sign. Sometimes, especially as we become older, we all feel aches and pains. This is especially true for older people. On the other hand, if the pain is severe, abrupt, or seems to be getting worse by the minute, particularly in the abdominal region, it is not something that should be ignored or put off until eventually it goes away. The presence of severe abdominal discomfort may indicate the presence of a dangerous medical condition, such as appendicitis, a perforated ulcer, pancreatitis, or even internal hemorrhage. A ruptured organ or a plugged intestine are two conditions that can be life-threatening if they are not treated immediately. Abdominal pain in older persons can potentially be an indication of either of these conditions. A trauma surgeon once emphasized that when a senior citizen complains of acute abdominal discomfort, we take it extremely seriously since time is the most important factor in determining whether or not the problem is one that can be fixed or one that would ultimately be fatal. It is important that you keep this perspective in mind because the danger of complications is higher for elderly people, and the traditional symptoms of sickness do not necessarily manifest in the same manner with each individual. It's possible that you also don't have a temperature or any obvious swelling. You can only have a strange feeling, or you might suddenly fold over in pain without any prior notice. Regardless of the circumstances, your body is communicating with you, and you must respond to it. Give me the opportunity to tell you about Frank, a widower who was 72 years old and took great pride in his toughness. In the middle of the night, as he was finishing off his food, he had a sharp discomfort in his lower abdomen. Following his assumption that it was gas, he went to bed and took some antacids. By morning, the discomfort had become intolerable, and he was unable to stand on his own. When his daughter called for an ambulance, the emergency room staff discovered a portion of his intestine that had become twisted and had blocked the flow of blood. His life was spared by a spontaneous operation. Frank later stated that he believed it would be temporary. What I didn't anticipate was how quickly things can move from bad to worse. This is not an unusual circumstance. However, when the pain is severe, continuous, or unlike anything you have ever experienced before, it is not the time to try to brazen it out. Seniors frequently minimize the severity of their pain or wait to see if it gets better. The time has come to enter. Being cautious will not cause you to lose anything, but waiting for an excessive amount of time could cause you to lose everything. Do not speculate if you get extreme abdominal discomfort that does not go away, particularly if it is accompanied by nausea, vomiting, or dizziness when you are experiencing it. Try not to Google. Go. A persistent vomiting or bloody vomiting is the sixth sign. It is unpleasant to experience nausea and vomiting on occasion, which may be caused by bad food or a stomach bug, but it typically goes away. When, on the other hand, vomiting persists for a number of hours or when there is blood present, it ceases to be a mere annoyance and instead becomes a significant clinical concern. Constant vomiting can result in severe dehydration, an imbalance of electrolytes, and even kidney problems if it gets out of control, and the presence of blood in your vomit, regardless of how small the amount may be an indication of something much more serious, such as bleeding in your stomach, a ripped esophagus, or ulcers that have ruptured. According to the words of a gastrointestinal professional, blood and vomit are never considered normal when it comes to identifying internal bleeding in older persons. This is one of the quickest methods we use. That ought to put a halt to anyone who is considering it, particularly considering the fact that some individuals dismiss it or misidentify it. Blood can have a bright red appearance, or it can have a black, gritty, and surprising appearance, similar to that of coffee grounds. It is a symptom that something is going wrong inside of your digestive tract. Regardless of the circumstances, when it comes to elderly people, this may be a reaction to medications such as anti-inflammatory drugs, a result of an undiscovered ailment, or even damage to the stomach lining that is caused by stress. Take, for example, Evelyn, a woman of 79 years old who had been treating her arthritis with pain medicines that were available without a prescription. Following dinner on a particular evening, she began to throw up. Initially, she placed the responsibility on the shrimp, but when she noticed dark flecks in the sink, which she believed to be remnants of perished food, her grandson demanded that she call for assistance. The specialists at the hospital confirmed that she had a bleeding ulcer that had been slowly developing over the course of several months. In her admission, she said, "I had no idea that it was that serious. But if I hadn't gone in, it's possible that I wouldn't have made it through another day." It is impossible to stress the importance of this warning. It is not a matter of waiting till morning to experience blood in the vomit. This is not something that can be remedied by drinking ginger ale or sleeping off. It indicates that something malfunctioning within your body is causing fluid to leak into areas where it should not be. Only prompt medical attention can diagnose the cause of the problem and put a stop to it in a timely manner. Regardless of whether it is a damaged stomach, issues with the liver, or a ruptured blood vessel, I would appreciate it if you could use the 6th comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Now, let's proceed with our plans. There is a high fever, a stiff neck, and sensitivity to light, which is the 7th sign. The presence of a fever is typically an indication that your body is attempting to defend itself against something. However, if the temperature is high and accompanied by symptoms such as a stiff neck, headaches, confusion, or difficulty with bright lights, it may be an indication of meningitis, which is an inflammation of the protective layers that surround the brain and spinal cord that can be severe and potentially fatal. Despite the fact that meningitis is more prevalent in younger individuals, it is not impossible for older folks to be affected by it. This is especially true for those who have compromised immune systems or who have other persistent health problems. In addition, when it does, it can move at a speed that is impossible to ignore. According to a statement made by an emergency physician, we should immediately drop everything if an elderly patient comes in with a fever and is unable to flex their neck or handle the light. The level of urgency is that high. The sense of urgency that you have conveys a lot, mainly due to the fact that by the time these symptoms manifest themselves, the infection can already be in full action. Even though it may be uncomfortable, the stiffness in your neck is actually your body's way of letting you know that the lining that surrounds your brain is inflamed. Additionally, the sensitivity to light is not merely a nuisance, rather, it is an indication that your central nervous system is not functioning properly. Additionally, it may be accompanied by feelings of nausea and vomiting, as well as the sensation that your head is about to burst from the pressure. And none of this should ever be looked at as nothing more than a minor glitch. Let's take Jerry, a widower who is 75 years old and enjoys doing crossword puzzles. Because of the throbbing headache he was experiencing, he was unable to do his daily puzzle one morning. He was unable to look down since his neck was hurting so badly by the afternoon. And the light that came in through the window of his kitchen was intolerable. To his great relief, his neighbor, who had previously worked as a nurse, quickly recognized the symptoms and transported him directly to the hospital. The diagnosis of bacterial meningitis was verified by the medical professionals, and quick treatment allowed Jerry to survive. In a later statement, he stated, "I thought I was just run down. I had no clue that it could be anything of such a terrible nature." Because it is the truth. The warning signs that your body is sending out, such as fever, stiff neck, and sensitivity to light, are not an indication that it is overreacting. and you should not do the same. Given that meningitis is a condition in which every hour counts, these symptoms indicate that something is attacking your nerve system. Don't be reluctant to seek treatment, it is available, and it is most effective when it is initiated at an early stage. Do not wait for an appointment or attempt to sleep it off if you or someone you care about in your life is exhibiting these symptoms. It is best to go to the emergency department and allow the professionals there to handle the situation. There is no way that you will ever regret taking precautions with regard to your health. But delaying could be a risk that you simply cannot afford to accept. A few concluding thoughts. It is time for you to win. And it is time for me to win my tournament. You have probably realized by this point how vital it is to pay attention to the messages that your body is sending you. Particularly as we enter our later years. It is not the intention of these 7 indicators to terrify you, rather, they are intended to give you more strength. Understanding when to take action is not a sign of weakness, rather, it is a sign of wisdom. And wisdom, particularly the type that comes from years of life, involves having the understanding that your health is something that should be treated with urgency rather than delay. It is simple to dismiss certain things, to say that I will be all right, or that it is probably nothing at all. However, in many of the situations that we discussed today, the only reason that people were spared was because they made the decision to take action. Mostly due to the fact that somebody saw the sign, picked up the phone, or drove to the hospital. In those moments, everything changed for the better. It is important to keep in mind that taking care of yourself is not just for you, but also for your family, your friends, and the people who care about you and require your presence in their lives. They will have the opportunity to take pleasure in your affection, your stories, and your wisdom each and every day that you remain safe and strong. Therefore, you should treat your health as if it were a priceless gift. We appreciate you being here with us today. It would be wonderful if you could get in touch with us. In the comment section below, please share one thing that you have learned today and how you intend to put it to use in your life. Happy learning! We place a high value on your opinions, so please do not be reluctant to share them with us. Our inspiration and encouragement are greatly increased as a result of reading your remarks. I would appreciate it if you would like, subscribe, and share this video if you found it to be informative and enjoyable. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. We appreciate you taking the time to watch, and we hope to see you in the future video.